Hello, everybody. This is our first live event for the Boston Congress of Public Health / Harvard Public Health Review, or formerly Harvard Public Health Review, HBRHR Journal. We are so fortunate here to have with us today Matt Kazam, and we're going to be talking a little bit about his course that's coming up on the 28th, and
Yeah.
still time to sign up for it. And he's going to talk a little bit about what he's going to cover in the course and some of the work that he does around public health and training up public health leaders like you to be better communicators. So, Matt, I want to hand it over to you.
Oh, well, thank you so much. And thanks for having me. And thank you to everybody watching and who's going to watch it later. And, it doesn't happen a lot. And we talk about this that's in the world going through a pandemic and mental health crisis and just life crises. The public, no one's really thanking the public health people out there that are just out there fighting the good fight for the good fight's sake, just for humanity's sake. And that's kind of what drew me to this space and drew me to you and the work that you do, is that this is a group of folks that are in the communication business. I mean, as much as it's health and your doctors, you're not in the medication business. You're in the information business, and that is something I've studied for 30 years, whether as a comedian or as a speaker or a trainer, just a human being of earth, and watching the challenges just pop up from the new landscape of how we are forced to communicate now. And for as great and passionate and brilliant as the minds out there watching are, this is a tough thing. I spent my life figuring out human connection. I mean, if you're going to have an impact, that's how you're going to win these days. It's not just information. We see where that gets us. But it's really about story and human connection and your humor when possible, but if not, leaning on the basic tenets of humor, because we're in the human business, and we're nothing more human than humor, and how to make that connection with people. That's the most important thing these days. You got to get them to think differently and act differently, and you have to gain their trust, and you have to engage them. And we've talked about this digitally. We have 1 second. Hopefully, if you're still watching, then we've engaged you in one form or fashion. But you have 1 second to engage folks, and the way to do that is through authenticity. We all talk about it, but I don't think anybody ever gives you kind of a blueprint on how to be yourself. It seems like an easy thing to do. I'm just going to go out there and be myself, but it's what people are going to resonate with. It's one of the things I'm going to teach is how to win before you get to the microphone or you press, the record button on the video, thinking this through and always putting the audience first, and just adding a layer of empathy and execution. This may be not things you've thought of before, but it is the blueprint of how I spent my entire life. And that's what I'm going to share in the course.
Oh, and what if someone came up to you and asked about being someone who's worked in the comedy world, and how does that relate to being able to talk about matters of health? And what would you say to them?
Oh my gosh. I mean, if you're not going to use this science, you better come up with some kind of science, because you're talking to people about their health. These are the things that make them shut down. And not just that, in the public health space, you're kind of spending them, telling them how they should spend their money and how they should raise their kids. This is a shutdown trifecta. So, I have to get them to open up and break through and make a connection with the subconscious. So it's not just information being processed. I'm actually connecting and hardwiring the data, which is really just a story. I mean, all of this has a story. That's what I love about public health. It all starts with the root causes. And, so there's tons of elements for story embedded in the work you do, though most just, kind of decipher, disseminate the information. But the science of what I do, walking out on stage, getting an audience to trust me, same thing. It's apples to apples, the skill set that I've been doing for the last 30 years and the work that public health people have to do every day. And it's not just about, patient to policy. It's also communicating with each other, across a
Mhm.
whole bunch of different disciplines. Even if you think, oh, I'm just a researcher, or I'm just, I'm not out there giving those press conferences, thank God sometimes, but you still have to communicate, your data, your science, your research, and, telling the story of this is really, what we're going to focus on in the class, and what's going to make things much easier going forward, if you really want to make an impact and change.
Could you give like us a little like sneak peek at something you might address, perhaps like a common issue or a common mistake folks make when they're trying
Oh,
to talk about a public health
sure.
policy?
Absolutely. Well, for everyone, the one big problem is people write words to be read versus said. So one of the biggest problems, because I audit a lot of the videos and I watch a lot of the public health stuff, and and I'm like, that would be great if you could say it like a human being, and not just kind of like a robot. But it's the nature of everyone, because they've written the words, to be read, and not as dialogue that they're going to say. And we're going to really talk about building this content that can be replicated and duplicated in so many different situations, because it's not just one time you're going to go out there and give a press conference and give out the information. You've spent years on these studies. You're going to have to go out and tell those stories, and the content can be repurposed for media and can be repurposed for one-on-one, and when you're speaking in front of big groups or small groups. But the content will be kind of like jokes, or kind of like a comedian's material. The reason we know it'll work every single time is we built it that way, and then we just find ways to kind of repurpose it for different situations, and we're going to talk about that. But lots of little nuggets and takeaways, and also learning, we're at our best and at our safest when we're making each other laugh. And that's what humor science. It isn't about taking your thing, your work, and turning it into a stand-up comedy routine. It is about taking the science of that human connection, that engagement, that layer of empathy, understanding that every audience is different. But most of the time, we're just worried about the things we're going to say. But we're always going to put that audience first, and then we make choices kind of based on that. And in the end, you'll find out that this is a lot like math, because every one of these things is about the variables. But if we think about those things ahead of time and build the content to accomplish the goals that you're trying to accomplish, you'll have a blueprint, and then you'll be able to make so much more impact than possibly you could now without it.
Well, that just sounds incredible, Matt. If folks had questions, how might they get in contact with you?
I'm on LinkedIn. You can find me on the LinkedIn, Matt Kazam, or my company, They Laugh You Win. There's an email portal there, or I think on hphr.org through the Humor Scientist. There might be a way. And definitely check out the Humor Scientist. I think if you see what we're talking about there, about, you know, connection it's just a word we kind of throw around, but nobody really has an approach to kind of ensure that it happens. And I think understanding the audience, and thinking about what's been done to all of us at this moment in time, whether it's the media, and the other problem a lot of times is our agendas aren't aligned. A lot of
Mhm.
times, I mean, the audiences at a media event, it's click, click, click. We got to get clicks. We got to get some clicks. And you're out here trying
Mhm.
to change the world. And then even when it's an audience who's doesn't necessarily want to be told, everyone's telling them how they should live their life. You have this layer of empathy, and then you make the choices, not instead of just going, I'm going to do what I'm going to do and hope for the best. It's about strategically using story and human connection to accomplish your goals. And from having to do, stand-up comedy and teach, in front of tens of thousands of people, and in small groups as well. The science works every time, and it'll allow you to not be so stressed out every time, because no matter what happens, you're going to have to go out and deliver this information. You're going to have to go out and try to get people to, like I said, think differently and act differently. So, that's all in there, and it's 2 hours, and it'll be fun, and there's lots of stories, and really, it's about the application of what you're doing every day. I put so much thought and care because of the respect that I have for this amazing group of people out there, really trying to make the world a happier, healthier place for everyone. That's a good group for me to try to empower, and so I'm so excited. I hope it shows. I'm very excited.
We're really excited about this as well. Um, what I really like about what you're doing, Matt, is that you're not necessarily training public health folks to be comedians. This is about really building up those skills to immediately engage with other human beings as human beings and communicating this really important data that can potentially save lives and make differences for future generations.
Yeah.
And it that matters whether you're doing policy, whether you're trying to convince someone to change their health behavior, to go get a screening, if you are teaching a class, or if you're even eventually doing something akin to a TED Talk or presenting data to a large conference. I mean, these skills are invaluable. And it's really important for our audience as the Boston Congress of Public Health and also for our readers of HBHR Journal. These are folks who are so dedicated to social justice, to health equity. And you're doing such an invaluable service by providing an avenue to get these skills. So the course, just to reiterate, is
Yes.
Tuesday, June 28th, 6 to 8 p.m. Eastern
Yeah.
Standard Time. Um, I'm going to be sending out a message to, again, with the link to sign up for the course. If you have questions, contact us at communications@bcph.org. Um, or just simply respond to our social media messages and we'll get in contact with you. We are so excited about this. This is
Yeah.
our first foray into doing online trainings through the Boston Congress of Public Health, the BCPH Academy. Cannot think of anyone better to be our inaugural professor than you, Matt. Um,
And it's
and
going to be
thank
great.
you for
And they
flying
can
to
watch it
Cleveland.
live. The great thing about, why not just release the course? I think it's again thinking about the audience first. If you can join us live, it'd be great, because I
Mhm.
think that's the best way to learn. I mean, think about it. You teach as well, I mean, it's if it's live, I think, and I get your presence for that 2 hours, we can do some amazing work. But if not, you'll have the recording, and still, if you watch the recording, there, like I said, there are so many takeaways, so many ways that I'm going to change the mindset on how you approach, this thing of human, interaction. Uh we've been sold a lie. I'll leave you with this: is that somehow public speaking is supposed to be hard. That it's something that humans can't do, and we've bought into it. I mean, Seinfeld has a joke that says people would rather at a funeral be in the coffin than have to give the eulogy, because people hate public speaking so much. But it couldn't be there couldn't be anything more human, and that's what I really love about public health, is that I would say if the world ended tomorrow, I would still get up and go to work, because my job is just about making people laugh. And there's hunters, there's gatherers, and I'm going to make them feel less stressed out about the hunting and gathering. But public health goes back to the dawn of time. I mean, before there was actual MDs, prescribing bark and plants and medicine. At some point, there was a public health person getting them to stop pooping in the drinking water. I mean, they had to find a way to you can't just tell people to stop pooping in the drinking water. They had to find a way to connect with the folks, or we wouldn't be here today. Something would have wiped us out. And they're always at the front lines, public health folks, and especially today. So that's what the course is, because I really do understand the mission, the passion, and I just want to help, give you some new skills to get you through that, because it's what I think about and have thought about for 30 years. While you've been worrying about viruses and sanitation and social justice, I've been worrying about, what, how can I not just make these people laugh, but make them feel? And that's what I'm going to teach you.
Well, thank you so much for applying your skills. I know I've benefited a lot from your assistance and your training, and I really cannot recommend it enough. Um, we look forward to seeing you next week, Matt, as well as everyone else who has signed up. And if you haven't signed up yet, there is still time, and it is truly worth it. It is something that you probably did not get in medical school or in public health school, or hiding behind others in Toastmasters. I don't want to say that happened, but I know I was someone who hid in Toastmasters. So
Yeah.
this is
And
teaching me.
really, everything, as you know, it's all intuitive. All I'm doing is bringing the human to the surface, and that's where the authenticity comes from, is that, we're all wearing masks, but in this day and age, the silver bullet is being yourself. That's what's going to resonate with folks. It doesn't matter whether or not you deliver the information the same way. It's if you deliver it as yourself and you show up and show the passion that I see all the time just in interacting with public health folk, that I don't necessarily see when they're forced to kind of communicate that to the masses, or even even to the patients, and you'll see it. The paradigm will shift instantly from this change in mindset, and then you can focus on the bigger things. This isn't that hard, and there's a lot of real data and science to back that up that I'll share with you on the 28th or in the video. But we're going to do more, and I love this group, so I'll see you all very soon.
Oh, wonderful, wonderful. Thanks so much. We're going to end our live session today, but we'll still be around. Just send us a message on social media or via email, and we'll be in touch soon. And we look forward to seeing everyone next week. So,
Take care. Bye.